Hi, everybody, and welcome aboard to Local Matters, where living local never felt so good. You know, March is Colon Cancer Awareness Month. Officials at Regional Medical Centers Foundation encourage you to get tested. You know, research shows you are 20 times more likely to survive bowel cancer if detected early. This explains why RMC Foundation are providing free take-home kits. When we come back, we're going to be talking with RMC physician who will help us better understand the collection process of this non-invasive screening option. You know why? Because if it's local, it matters.
Dance. Let me see you move.
Baby, love never felt so good. Can't I die if it ever could? Not like you.
Hey everybody, welcome back. Thanks for joining us. You know, March is Colon Cancer Awareness Month. That's why officials at Regional Medical Centers Foundation encourage you to get tested. They are working hard on raising awareness of the many options for colon cancer testing. Joining me here of Local Matters is Dr. Mohammed Elabadi. I've said it wrong. Elabadi. Tell me how to say your name.
Elabadi.
Elabadi, and he specializes in gastroenterology at RMC. So welcome aboard. Welcome aboard. I've got to get your name right. Mohammed Dr. Elabadi.
That's right.
I've got it. I've got it. So welcome aboard.
Thank you, Ms. Dottie. It's really an honor and a pleasure to be here.
Yes.
And it's a great opportunity to be able to spread the message across about an important matter, not only local, that can potentially affect everybody at certain point in their lifetime. So I think chief message is going to be if you hit the age 50, even if you're not having symptoms, you need to talk to your physician about the various options and modalities of how you get screened for colon cancer. Important research have shown that people who are screened for colon cancer compared to those who are not screened are not only likely to find their cancer early, but are more likely to survive if the cancer is detected.
Wow. And you've been doing this for many years, because I understand you've only been at Regional for what, for about 5 years?
Yes, ma'am.
But prior to Regional, where were you?
I was born and raised in Beirut, Lebanon, and I went to medical school there at the American University of Beirut. Then joined, I did my internal medicine and gastroenterology training, and actually part of my training I did research fellowship in what we call outcomes research, and I was also able to get a degree in biostatistics and clinical research. Then I joined the faculty at University of Alabama in Birmingham for 10 years.
Wow.
Where I worked on a lot of modalities in detecting cancer and diagnosing cancer. It's called ultrasonography, which is a totally subject that is not relevant to this discussion, or might be partly relevant, but I'm sure we could get to talk about it in another meeting. And then shortly after that, for 3 years, I went back to Lebanon, where I was a full professor at the American University of Beirut for 3 years. Then I came back here to work in Anniston, where I had so far a great experience locally. And
you seeing, I mean, you know, what are you seeing here in Anniston? Are you seeing where people are really embracing cancer screening? Are they really embracing that idea of coming in and getting?
Certainly people, when they come to you, they already have seen their physician and their primary care physician, who play a very important role in this disease. They typically recommend to their patients that for various reasons, whether we have to make a distinction here, whether patient symptomatic, meaning they're having symptoms, which is abdominal pain, bleeding, diarrhea, altered habits, versus a 50-year-old who's otherwise healthy. She or he has never had anything done, but they are at that age. And this is the cutoff that the American Cancer Society and other societies have used. Breast cancer, prostate cancer, and other cancers that are to be where screening is known to be effective. At the age of 50, if someone even asymptomatic, there's nothing more disheartening when I see a patient who I diagnose colon cancer in, and when we ask them about their family history, well, they answer that my mom had it, but I was not having symptoms till now, and they are in their mid-60s. They had missed an opportunity for this cancer to be detected early before it caused bowel obstruction, bleeding, and even spread to other organs like the liver and lungs, which then becomes an incurable disease. So the chemotherapy and the treatment they're going to get is at this stage palliative and not curative. So our purpose is really to detect the cancer early, so the person who has been diagnosed with this particular cancer from it.
So I think we've got to go to break in just a moment, but I think what I really want to do when we come back, because I want to zone in on if a person's not having any symptoms at all. Let's say they're younger, because you shared with me patients younger and younger coming in with colon cancer.
Yes, and this has been a recent publication in JAMA actually that have shown that there is a spike in colon cancer in patients in the 30s and 40s and 50s compared to the earlier stages where we used to see cancer in most people in their 60s, 70s, and 80s.
Right.
This is the result of aggressive screening that has been in this country, although it's not where we want it to be.
Right.
But this has decreased the incidence of colon cancer in elderly, but we've seen a spike, the results of which are still unknown. Why we're seeing this in individual is a matter of research and investigation at this point.
Right.
But we would like to get the message across, even if you're in 30s and 40s and you start seeing unusual signs, your bowels are not what they used to be, you're bleeding, you're having pain, you need to come forward to your doctors and say, this is kind of unusual for me, and I need to know why it's happening.
Right.
Hopefully that would spark an investigation to see whether this is related to a tumor or something else that could be causing the symptoms.
All right, well, we've got to go break. When we come back, we're going to be talking with Dr. Muhammad Ellabidi. We'll be right back with more Local Matters. Don't go away. Hello, everybody, and welcome back to Local Matters. We're living local so darn good. I'm Dottie Rimsey, and I'm sitting here with Dr. Muhammad Ellabidi, and we have been talking about March being Colon Cancer Awareness Month and how important it is to be screened. I mean, before we went to break, Dr. Ellabidi, before we went to break, we were talking about the importance of being screened. And you mentioned that you're starting to see research shows that there's a spike with younger people who are having some issues being diagnosed with colon cancer. And it seems as though that older people are taking advantage of their screenings, but it seems younger people who are having some issues are ignoring those problems, and they're reluctant to come in being tested. Why do you think those barriers are there?
Well, the subject matter might be something that some people are shy to talk about. Till it becomes like persistent. Some people feel initially that, okay, I'll wait a little bit, see, maybe it'll go away, and month after month, and then after
they get busy with life too, and say, I don't have time to do all of that. I've got too much to do.
And then some people say, you know, they start losing weight, they start having progressive symptoms, and say, well, I better go get checked. I've seen some younger individual who waited a year with bleeding that was attributed to hemorrhoids, and they were told you have hemorrhoids, and then they come and they have a big problem. So I think it's important to go get checked if something has occurred that is not part of your usual routine. The other thing that is very important as a barrier for screening for colon cancer, which is different than people having symptoms, the majority of the individuals who approach them about cancer screening, and talking to their physician, the majority will agree to some kind of screening, which I hope get to cover today.
Yeah, I definitely want to talk about the different types of
Yes,
screening tests.
but for example, people feel like they could be embarrassed to go have a colonoscopy done.
Yes.
Who don't want, but this is fortunately the minority. Some people had drastic events in their families where technology is evolving, and they had, for example, what we call a perforation, a tear in the wall of the colon. This is, even though it sounds catastrophic, but when recognized immediately, it can be fixed. Not that we're looking forward for it to happen to us or to our patients.
Right.
The minority, they just say, I feel fine, I don't want it done. But when you explain to them, feeling fine does not preclude that you have a polyp that's growing in your colon, and removing it early can prevent this colon cancer from developing and having radiation and chemo in the future. Most people actually get convinced that, well, this sounds reasonable and logical, and they go ahead with the testing.
And they go ahead with that. So are there various types of testing that are done in the office?
Yes, there are various types of testing, and I think are some what we call under the category of imaging. Some of it is outdated, is recent.
Okay.
For example, the old days they used to call barium enema, which hardly ever is for that purpose. Virtual colonoscopy, which is like getting an MRI of your colon,
Right.
can detect polyps. The disadvantage, you're going to take a prep, and then similar to colonoscopy, you need to be prepared, but the test will show or not show anything. The good news, if this test is normal and reassuring, one, it cannot detect flat polyps, so missed, and the person developed colon cancer. Second, if a polyp, it cannot be removed.
Right.
In comparison to colonoscopy, if you have, it's a test where you see and you remove it and you take care of it right there and then, rather than going through a stepwise testing.
Okay.
The other tests rely on detecting either blood or heme that's related, or even genetic material or DNA material in the stool itself without getting. And the advantage.
Is that the one? So that's what I wanted to ask you too. I don't mean to cut you. Is that the particular test that can be done at home?
At home or in the office in certain doctors' offices.
Oh, some doctors offices.
Newer test is called Cologuard that has been approved by Medicare to screen for colon cancer for those individuals. For one reason or another, they don't like the colonoscopy done. I really highly advocate this test because from what I've seen and the research that has done is fairly accurate.
Now, what test is this that you really
it's
highly
called Cologuard.
Cologuard.
The test that is has been advocated to detect DNA, human DNA in the colon to detect colon cancer.
Okay.
So it is a good test. Unfortunately, if it's positive, then you still have to undergo colonoscopy. The caveat for individuals who have a family history of colon cancer, this is not the first. The American Cancer Society and other societies recommend if you have a first-degree relative who has cancer.
And first-degree relative means your mom,
dad, your son, somebody directly related to you, then you have to have, or if you happen to have what we call familial colon cancer or familial polyposis syndrome, which is you need to even start in your 20s. But these are individuals who their immediate family members have hundreds of polyps in their colon, which is a very rare genetic disorder.
Right. So I guess right now, the whole essence of what we're saying right now, the importance of getting screened early
cannot be overemphasized.
And knowing that family history is so important.
It's very important, although sporadic colon cancer that comes without anybody in your family accounts for 75% of cancers detected. Yes. 75%. Only about 20% are related to either a known gene for colon cancer or familial.
Okay.
So they are in the sporadic category, which they happen. People have it in their families. It happens.
And that's called what? What now?
Colon cancer, meaning it happens without a link to being either a genetic disorder or a family member who had colon cancer.
Okay. Well, we've got to go to break. When we come back, I want to talk more about this whole issue of the sporadic cancer there. So we'll be right back with more Local Matters. Hi, everybody, and welcome back to Local Matters. I'm Dottie Rimpsey. Back. It's good to have you here. And you know what? I've been sitting here, all morning long talking with Dr. Mohammed El-Abidi, and we've been talking about the importance of really getting screening done for colon cancer. Dr. El-Abidi has shared with me that over the past couple of years, he's seen, and also research has shown, that there's been a spike in younger people being diagnosed with colon cancer. And we've also, you were telling me something, you mentioned sporadic cancer, thing happening there where people have no symptoms at all.
Right. Sporadic, the term in English means like comes out of nowhere.
Yeah, just
basically.
out of nowhere.
So we were saying that 75% of all cancer cases are not related to family history or genes that we know about.
Right.
So that's why people saying, well, I don't have it in my family, why I don't need to go check? Well, that's not the rule.
A lot of people do, I mean, and I don't mean to cut you off, but a lot of people do feel like that. I was talking with a young lady the other day about getting tested, not only for colon cancer, but for breast cancer as well. And she said, well, I'm not going to do either because it's not a family. And I was like,
and this is not
yeah.
appropriate.
Yeah.
I think people need to get checked because it happens in people without family history. Of course, it's more alarming when you have it in your family. And that's, like I said, disheartening. I just diagnosed in the house where they both had intestinal obstruction, and they had to undergo surgery to bypass the colon. Them had, for sure, her mother had colon cancer in her 60s. When I asked her, she said, well, I have been feeling fine till now. So she had an opportunity to check at least 10 years earlier.
She never took advantage of it.
No. The recommendations are, if someone has it in their family, to get checked 10 years earlier. So in the hope that if they start growing, then this is when it's detected at early stages and hopefully treated appropriately and cured from disease, rather than wait till it obstructs the colon and they come with pain and vomiting and symptoms they require. And sometimes it's bad as out of the bag, as it has spread organs and is stage incurable colon cancer. Devastating.
You know what I find that, too, Dr. El-Abidi, is that many times people are not coming in, they're reluctant to come in and get tested because this is not a basic fear. People are like, well, I don't know, I just don't want to do it. I don't have any problems. So, and as you mentioned, we've been talking about the different tests that one can have. The simple one that the foundation will mail out to people, if all they have to do is and ask, they're going to be mailing out. What is this, a FIT test?
It's a stool test that can be done at home and privately. I think it's a stool test that will detect blood or blood component in the stool. And the foundation, I think they have about 50 to 100 kits. They're giving them for free.
For free?
And if that become positive, we'll be more than happy to follow up on these, do the appropriate testing to see, because when you have a positive test, that usually indicates there is an underlying problem that you need to be tested for.
Tell me about, I mean, I don't mean to cut you off, but tell me about this FIT test. The FIT test is being distributed by the RMC Foundation. I know we have a full screen there. I want people to be able to call and to ask for the appropriate person. I believe it's Lagenia Filligan that they can ask for. Yeah, there it is on the screen. They can ask for Filligan, and a number there, 256-235-5547. These FIT tests, it's very simple from what I understand. Tell me a little bit about that test.
It's just basically they take a stool and put it on the kit as described, and then this would be mailed back to the physician or to the address on it, and then we'll look at it. If it's positive, then we'll recommend to that person to undergo colonoscopy to know why this test is positive. See if there's polyps or cancer.
You're right. That doesn't mean they have cancer now, just if it comes back positive. Okay.
Not really.
Okay. But they need to just then follow up. They can follow up. And I know that you, as you mentioned, you've been with Regional now for about 5 years. You're there at the Physician Center. What's your what number where people can contact you? Because this is our RMC. This the big campaign right now that you guys are really pushing and urging people to really get early screening.
Well, Dottie, when you ask me about doing a long time ago, we're really not trying to advertise for particular practices. I think I will give my number, but
Right.
my number is 253-71001.
Right.
We have in the area three other gastroenterologists who will be more than happy to see anybody who's interested in screening.
Right.
These are my colleagues, and we work collegially together. I think the whole idea from why I wanted to do this program really to get the message across.
Yes.
Because my belief and my religion, if you have saved one life, as if you have saved whole humanity, and if you killed one soul, as if you have killed the whole humanity.
Right.
So I think once we feel like we're helping somebody, particularly those that cannot get testing, because one study we did here in Alabama in 2005, published in Southern Medical Journal with Dr. Shipp, who was a postdoctoral student. Access to is a major problem, and insurance issues is a major problem. And we campaign, and hopefully we'll try in the future to find more resources to be able to get this across to individuals who are mostly in need of these testing. And poverty and low social class has been a major determinant why people have advanced disease and colon cancer.
Right.
The other pertinent piece of information, which we don't know why, people who are with African American descent or the black race to have earlier onset and more advanced disease at presentation, and hence some societies recommend those individuals to even if they are asymptomatic without family history, to even start earlier at 45 in the hope to close the gap in survival and outcomes, and hopefully they get tested earlier and get colon cancer detected earlier.
Certainly, thank you for coming,
Thank you,
Dr.
Ms. Dottie.
El-Abidi. I want to bring the full screen up one more time. If we, I know we're running out of time, but if we can bring that full screen up one more time, because we are encouraging people to call not only Dr. El practice, but there are other physicians in the area that you can certainly call RMC Foundation and ask for those fit kits if you are not sure if you want to go into a doctor's office at this time. All right, that's going to do it for now. We certainly will be back here next time for more Local Matters. Good night, everybody.